I joined Cayuga Health System on March 2nd. I saw Cayuga Health System as a great place for me to work because I saw a lot of opportunity to innovate and to build value. There's definitely a desire on the part of the leadership to be able to meet the needs of our community and meet them in new ways and try new things. And I think that was demonstrated by our work with New York Presbyterian and Weill Cornell in our trip down to New York City. My personal motivation for going down to New York City was the need to really care for people. So I recognized that there was an unmet need down in New York and that we had the resources to be able to help. And my personal philosophy is, if not me, then who? And if I'm going to recommend that a team potentially go down, that I'd want it to be a setting that I would go to myself. So I wanted to make sure that I was being supportive and I was able to provide any resources and reduce any barriers for folks that were doing that work. I went into medicine because I wanted to care for people, and this was really an opportunity to care for people in New York. It was very meaningful for me to be with our teams as they cared for patients in New York City. So some of the key stories and key takeaways that people shared were, it was an opportunity to connect with patients in new ways, to be able to build relationships, to be that caring, supportive person at the bedside, to be able to connect patients to their families when visitors weren't allowed within the system as well, and to be that caring, loving person at the bedside as people were experiencing advanced diseases and were passing away with COVID also. So it was a very meaningful new way of connecting for folks. And it also called out to a number of people how fortunate we are to live in Ithaca, in the Ithaca area, as well as to work within the Cayuga Health System, our culture, our way of working together. And I think that background will continue to help us grow and be able to provide great care with our patients that's patient-centered and holistic. I would send a big thank you to all the staff that made that choice, that decided to go down to New York, that saw a need and really found in their heart the desire to want to care for people and put themselves at personal risk and leave their families behind for a whole month to be able to serve in new ways. The fact that there were over 50 people here at Cayuga Health System that were willing to do that really speaks volumes for the people that are here and caring for our communities. I think we have something really unique here at Cayuga Health System. We continue to maintain an independent healthcare system here in upstate New York with really a changing environment all around us and a lot of different pressures as well. And we have a system that really wants to provide the best care to our communities as well and support value in the care for our patients. So now is a great time to be able to invest in our local health system, to be able to provide those services right here with leadership right here within our community that we can interact with and share ideas and grow and move together as the healthcare space changes so dramatically around us.